A to Z of emergency medicine. D is for droperidol. Droperidol is a first-generation antipsychotic similar to Haldol or haloperidol. Droperidol was taken off the market in the early 2000s because of multiple deaths reported to the FDA due to increase in QT interval or QT prolongation, leading to torsades and death. It was reintroduced in 2019. Everybody was super excited about it, mostly ED providers, because of its use in nausea vomiting. It was taken off the market in the 2000s because of the sedation doses that we were using back then. And I say we, that was before I was in practice, but like 5, 10, 20 milligram doses were leading to this QT prolongation, torsades, and death. The doses that we're using for nausea vomiting are like 0.625, 1.5 up to 2.5 milligrams, so much lower doses, with much less of this QT prolongation risk. What we're using it for is cannabinoid hyperemesis syndrome. So patients that chronically smoke cannabinoids and come in and they are vomiting profusely. If you've seen it, you know exactly what I'm talking about. One of my fave ED providers calls it scromiting, scream vomiting, the super loud vomiting patient that screams and vomits at the same time. It is a miraculous treatment for scromiting. Again, 0.625, 1.5, maybe 2.5 milligrams. It will stop hyperemesis from cannabinoid use almost immediately. It's miraculous. Again, so this QT prolongation, the concerns we had from that were much higher doses, 5, 10, 20 milligrams used for sedation. From this first generation antipsychotic. It does still have the black box warning for QT prolongation, and because of that, we have a lot of the warnings that the FDA requires us to put on administration of droperidol, that an EKG is required prior to administration. Do we enforce that? No. Would it be best practice? Yes, to get an EKG prior to administration. But again, that's the story with droperidol, a first generation antipsychotic now used largely for scream vomiting, scromiting, caused by cannabinoid hyperemesis syndrome at doses of 0.625 or 1.5 milligrams. Again, D is for droperidol. Farm ER.